Hi, Dr. Sasse here from Sasse Surgical. And if you're still battling with excess weight or obesity and you feel like your doctor is really not providing you with answers, you may need to advocate for yourself. You may really need to help yourself solve this problem. I say that because a lot of the medical community is still mired in this kind of misinformation gravity pull that sort of makes people think that it's your fault, that you got this way because you ate too much, too many calories and not enough exercise. And while there's sort of a kernel of truth that keeps that misinformation alive, what it really fails to understand is the gigantic change in the environment that has taken place in the last 50 or 60 years that has taken a condition that used to affect a very small number of people to a condition which now affects most people, and that is obesity. And so what we now know is that the changes in the environment include all sorts of new elements that were not present 60 plus years ago in the food supply, new genomics on the cultivars of major food staples such as rice and corn and wheat, and that these have an effect which is an obesogenic effect on the human body. Now, each person's genetic template may make them more or less susceptible to these environmental inputs, but that does not change the fact that this is an environmental disease. This is compounded by the use of antibiotics in agriculture and in human treatment, both of which are known to promote obesity. And that's just the beginning. The pharmaceuticals which we use to treat a lot of conditions, including mental illness, also contribute to obesity. So pretty quickly you paint this portrait of a whole lot of things that are largely out of the control of each person that are intersecting with our biology and causing an immense propensity toward weight gain, obesity, which then leads to diabetes and a lot of other adverse health conditions. But sometimes the physician community is sort of mired in old-fashioned thinking that, well, this is probably your fault and you could fix it if you would just cut down on calories and exercise more. And we know from the best peer-reviewed studies that nothing could be further from the truth. In fact, those studies, which involve huge, well-funded experiments where we had counselors, excellent state-of-the-art diet plans, medications, support groups, everything that we could throw at it short of surgery, resulted in transient short-term weight loss with subsequent full regain of the weight, if not extra weight. A lot of these large, well-funded studies were simply futile, was what the authors would describe the findings at the end. So we know that weight gain, obesity is an environmental disorder. We know that there are solutions for it that involve changing the tissues and that involve surgically changing what hormones are being produced by the body, and that results in long-term more favorable biochemistry and long-term more favorable weight, reduction in diabetes, reduction in stroke risk, reduction in health risks across the board. But we also know that a large segment of the population just doesn't really have that information. They just don't really understand the environmental cause. And while the experts in cardiology and the experts in endocrinology and the experts in pulmonology and many other fields understand it and their guidelines strongly support metabolic surgery, that often does not filter down to the rank and file medical community, who are often still mired in old-fashioned thinking and understanding about weight gain and calories in and calories out and exercise and a blame sort of mentality. So if you're in this boat and you find yourself trying to get help with your provider, your doctor, and they're saying the same things that someone would have said 50 years ago, like, hey, cut your calories and increase your exercise, and acting as though that's a solution for treating your hypertension or your diabetes and your obesity, then you may need to push a little harder and go get the facts and go get more information for yourself. Because otherwise you're going to continue on this risk curve, which is a heightened risk of a lot of adverse health events taking place, which could be prevented. All we have to do is look at the 30-year running data from the Swedish obese subject study, the best long-term longitudinal study comparing people battling obesity who have weight loss surgery versus people who don't have weight loss surgery in a really well-organized, controlled fashion in a first world country that keeps really good data and follows the statistics very strictly. And it's incredibly clear how the people who have weight loss surgery live longer and healthier lives as a result of that surgical intervention versus the people who have access to first world medicine and are getting care for obesity. They don't live as long, they don't live as healthy a life. So if you're not getting the answers from your medical provider, then dig a little deeper. Seek out more information. Try to educate yourself about metabolic surgery. Learn that it's one of the safest procedures going on around the world today. It's safer than an appendectomy or a C-section in the United States. And learn how it can change the long-term trajectory and serve as a powerful risk reduction tool, and that it is in no way comparable to diet and exercise, which sounds good on the surface, but is not a solution for obesity. It is instead an adjunct. It is a part of how to keep the weight off over time by emphasizing regular exercise and trying to eat healthy. But it is not a solution for obesity, unfortunately. To date, the only way that we can reverse that biochemistry that causes what's called metabolic adaptation or profound weight regain, hormonally driven weight regain, is by changing the tissues where those hormones come from, and that requires surgery. So I'll make that plea one last time. If your provider, with the best intentions, is giving you 50, 60-year-old advice, then advocate for yourself, get more information, seek out books written by me or other experts who discuss this and look at the actual data, and inform yourself, inform your loved ones so that you can make the best decision for your health. So as you can tell, I'm a little bit on a rant today, and I apologize if that's coming off a little bit strong or a little bit harsh. I know your providers mean well and they want to try to help you, but this is such a common problem that we see, and we see too many people who are not being helped adequately and are sometimes being discouraged from having the most helpful, safest treatment available to them today because of this old-fashioned thinking. And so for that reason, I urge you to get more information and advocate for yourself. All right, I hope that's been helpful, and with that, I wish you the very best of health.